Many people are reaching out to provide strategies to cope with telehealth situations and remote care in this setting. And I want to stress that we're not a reactive company, and the concept that we had is not necessarily unique to this COVID-19 situation. The concept of capturing remote assessments, remote patient monitoring through integration with Fitbit and Fitbit scales and wearables, which is also a component of our product, is just the beginning of what we see as a transition to asynchronous data capture, remote programming ultimately in one day, and the ability to incorporate a strategy to capture data in your clinic that's agnostic of where the patient is, how you're practicing medicine, and what's going on in the world. So what we've really started to understand is we know right now practices are trying to optimize a balance between in-clinic and remote visits, trying to understand how to best identify patients that need to be seen in person or can be relegated to remote visits and telehealth. What we know is that no matter what happens in the future, we have a solution that can fit into any of these categories: peak, transition, post-transition. The way we radically change the definition of success in pain care is something that will serve your needs irrespective of world events. Previously, as we mentioned, we were basically assessing patients in our clinics. Right now, it's mostly remote, but we really believe that the next phase is some strategic hybrid. Patients are becoming used to remote care, and patients with our devices who are doing well don't necessarily always need to be seen in our clinic. But we really do want to understand, hey, is this person not coming back because they're doing terribly? Or are they not coming back because they're doing great? This is a great way for you to have that touch point or that virtual check-in, which can be utilized as well with our platform.
Yeah, I think that's important because there are a lot of folks nowadays that are looking for developing strategies to remotely program. And I think it's also really, really, really important to note that there is some component of telemedicine that's going to stay. And I think having a remote assessment, the ability to check in with folks, when we talk to our colleagues around the country, everyone talks about their successes, but no one ever talks about how many people are getting their devices explanted or if they've shifted over to another practice. And we did an explant study a few years ago, and up to 20% of the people that got their devices removed, they were done so by another provider. And that is a lost opportunity to engage people in their care by just not asking the question and not doing it in a way that is that has a very simple and easy workflow within the community of your practice. And not only that, but it allows, I think this platform does allow you to have that data digestible quickly, that you can make a change in real time. I think that's really important. And that's hopefully one of the things that you'll take away when we talk about the strategic hybrid model moving out of COVID-19.